Hi, welcome back to another edition of Johnston Health Talk. I'm Liz Thurston with Johnston Health. Today we are talking about midwives, healthy pregnancy, and the maternal mortality crisis in the United States. We have two guests with us today. We have Farrah Forney, who's a nurse midwife, and also Holly Drake, who's a nurse midwife with Triangle Premier Women's Health. Triangle Premier Women's Health is located in Johnston County, in an office in Clayton and Smithfield, and we welcome both of them to the show today. Welcome. Thanks for coming. I'll start out with you, Farrah. Tell us a little bit about your background and working as a nurse midwife.
Okay, I was a labor and delivery nurse for Vidant Health. I also did medical surgical nursing. I worked for Vidant for 4 years. And then I graduated from ECU's midwifery program, and I started working here 2 years ago.
Okay, great. And how about you, Holly?
I was a labor and delivery nurse also in Detroit for about 6 years, and then when I became a midwife I worked in Flint, Michigan for about 15 months, and then I've been in Jacksonville the last 3 years, and in July I joined Triangle Premier.
Okay, and so midwifery is really kind of a new service, I would say probably maybe over the last 5 years in Johnston County. And I'm sure that we've probably maybe seen more of that in the larger cities, but or not. I could be incorrect about that. I'm just seeing that in Johnston County at Johnston Health, it is a new service for us. So we are definitely welcome you guys to that. So tell us, Farrah, what does a nurse midwife do? How is that any different than a physician?
Well, a nurse midwife is a nurse, first of all, and then they go through graduate training to become an advanced practice nurse. Midwives provide OBGYN care that's more holistic and more personalized. We kind of look at the whole woman instead of just, the medical aspect of the woman or the physical. We're also looking for optimizing like wellness instead of just looking for pathology, like looking for things that are wrong.
Okay. And I know, Holly, you provided us a short video on explaining that, so I think it's important. It's nice to kind of see that video first, and then we'll talk more about it.
Absolutely.
Okay, so let's take a look at that video now.
Okay.
Midwifery?
Midwifery.
Is that right? Midwifery?
I don't know.
Midwifery.
Midwifery, yes.
Is that like a female in her 30s, like, I don't know, married woman?
I know they help during the birth of a child, but that's pretty much all that I know about it.
A midwife can also, as I know, like provide some pain relief in terms of like breathing exercises and things like that.
I think midwives work at a hospital.
Some are in hospitals, some are at home.
I don't think they work in a hospital.
Midwives are everywhere. We're in the home, offices, giving prenatal care, giving family planning care. We work in hospitals, we work in birth centers.
Most people, when you think of a midwife, you just think of somebody who helps women have babies. But we do a lot more than that. We work with women throughout their life cycle.
When someone comes to see a midwife, they often wonder about what we can do for them as far as pain management, as far as medications. They're worried that if you're with a midwife, you can't have an epidural, for example, which is not true. I think a lot of people are surprised to hear the level of training and education that is required to be a midwife in the U.S. because midwives do so much more than just birth.
We provide personalized care.
The main reason I chose a midwife is because I wasn't a number. I was actually a patient, I was actually a person with feelings, and they were gonna devote the time that I needed to answer all of my questions, address my concerns. They want you to make, good choices for you and your unborn baby. I'm so glad that I chose a midwife. It's definitely an ongoing relationship.
Midwives have reduced the cesarean section rate in this country. It's overall been drifting up in the range of 30%. The midwife practice here at GW has a cesarean section delivery rate of 5%. Physicians plus midwives is a way of putting together a collaboration that responds to what the patients want. Doctors should advocate for the midwives. I enjoy the sharing, I enjoy the collaboration.
I chose a midwife because they are trained to deal with birth as a normal process, not a medical emergency. I plan to use a midwife for the rest of my life for my healthcare needs. I trust them and know that they have my best interests in mind, and that's really important to me.
As midwives, our philosophy of care is based on respect for women.
We put the woman and her family at the center of the care and then build out from that.
We collaborate together. We're partners.
I think all women deserve a midwife.
Every woman deserves high quality, evidence-based, personalized care, and we're here to make it happen.
So Holly, as a nurse midwife, and you've been practicing for how many years?
Just over 5 now.
Okay. And so being new to Johnston County, how are things going? Are you seeing a large search for nurse midwives? How's your clientele coming?
Yeah, I think it's coming along pretty good. I think that we need to get out there and touch the public. I don't know that they know we're here and a lot of it, but most of the patients have been very welcoming. When we see patients, we always explain, that we are partners in their care and that we make decisions with them and that it's not a hierarchical relationship and that we are doing things with them instead of to them. I think that's kind of one of the mainstays of midwifery. But also that we work with our physicians and that we, that they're also partners in our care and that we're a team.
Yeah. And I think a lot of times when you think of nurse midwives, we think having babies at home, or not using any pain medicine, that type of thing. So tell us more about the services that you're offering at Triangle Premier Women's Health. So go ahead.
Okay.
Sorry.
Well, we offer just routine prenatal care for low risk and high risk women. We usually try to focus on the lower risk and leave the physician care for high risk. So just like routine visits, we do your PAPs, we monitor for problems throughout pregnancy. We educate you throughout the pregnancy, help you come up with a birth plan. We also provide an intrapartum care, so during labor and delivery we provide support and we monitor the physical well-being of the woman and the baby.
Okay. And you, Holly, you can answer this. You both provide care not just for pregnancy, but for women.
Women care, birth control, family planning, annual exams. We do contraceptive implants, IUDs. Minor in-office procedures, removing those. We also have another advanced practice nurse that works with our Miss Tammy that works with us too, and I know that she does some other things that we don't necessarily do, but we all work together.
Okay, and we touched a little bit about the perception that you deliver at home, but most nurse midwives work in the hospital. Is that correct?
Right. About 90 to 95% of nurse midwives do work in the hospital. Some do home births as well. Our practice does not offer that service at this time. We support women regardless of their choice of pain management, that we educate them and we like to come up with whatever plan works best for them. If they go into this with a desire for an epidural, we support that. We also talk about like plan B and how to cope with labor and things that, educating yourself to make the decision that's best for you and your family.
Yeah. And Farrah, would you say as a midwife, I know that really the goal is to have that personalized care, and we said that a couple times, but really having that one-on-one with the patient and supporting their wishes and that. Are you seeing a lot of women, I'm sure, love that because you're not just another person coming into the office, that you really have that one-on-one?
Right, they feel that we know them personally, we know their story and their background, and we can kind of tailor their care, according to their needs.
Right. And so when somebody goes into labor, obviously they're at the hospital. And so are you doing those deliveries on your own? Are you assisting with a physician? How does that work?
We do those deliveries on our own. We don't need a physician to be there. Sometimes if it was a patient that we suspected we may have some issues, or if we have issues like with the baby's heart rate or anything like that, we may call our physician. Sometimes they're in-house for other reasons, but and they're always, you know, we always have a physician that is on call with us. They may not necessarily be in-house with us, but they're there if the need arises to consult with them. But no, we do deliveries on our own.
Okay.
We also do assist with our C-section, so just because a woman is planning a C-section doesn't mean that midwifery care is not right for her.
Okay.
We do assist, and we're in the operating room assisting the physicians with C-sections.
So if I was coming to you as a patient and then you realize that I'm going to need a C-section because of some high-risk issues, then you would still be there and assist, is what you're saying.
Yeah, and we tend to encourage things during the C-section, like, you know, getting the baby skin to skin as soon as possible, you know, helping moms breastfeed as soon as possible if that's their goals, but also just to be a familiar face there. Of course, we would have those patients meet, you know, the doctor that we plan to do the C-section with, and work together as a team for the best outcome.
Okay, and then you would still continue that care after the baby was born.
Absolutely.
Yeah. Okay. And Farrah, what do you feel like some of the benefits are for a patient to come to a nurse midwife?
Well, I think, you know, they do get that personalized care, and they get someone that's familiar with them. I think that's pretty much it.
Yeah, well, and that's important. That personalized care is so important, especially with positive outcomes in delivering, and we'll get more into infant or the mortality rates. But definitely want people to understand what a nurse midwife does and the fact that we have that services here and that it's becoming more and more popular because women are really, I think, engaging in their own care, which we hope that for all patients in all specialties to really be involved with their care and you know, having that one-on-one. And we definitely don't want to discount the physicians,
Not at all.
correct?
We need them to do our job. We cannot do our job without them, without a doubt. But we, you know, our focus too is on educating and having women be empowered and take more control of their care, because pregnancy is, in most cases, a normal, healthy state, and there are things that women can do to be proactive to have a healthy pregnancy versus kind of, I feel like a lot of women feel like they take their pregnancy and hand it over to their care provider and don't really know what to do with it. And part of our philosophy is we're teaching them to take some initiative and taking, you know, making sure that their provider, they're comfortable with their provider, they can have conversations with their provider, and that everybody's on the same page.
Yeah, and I think you're right. I think old school was, hey, I'm pregnant, give me, you know, lead me down this path, what do I need to do next? And now women are doing more research on their own. They're hearing, you know, what's recommended as far as have healthy deliveries. And what are some of the things, Farrah, that you recommend to your patients during their pregnancy to stay healthy and have a healthy delivery?
I encourage exercise, a healthy diet, and I go over all of that at the very first visit, taking a prenatal vitamin. I also go over like warning signs to look for throughout pregnancy, like signs of preterm labor, you know, like vaginal bleeding, you know, fetal movement, things like that. Warning signs, you know, things that should cue you in that something's wrong, that they need to come in.
Okay. Yeah, and listening to your body. I think that's so important.
One of the thing I probably say to every woman at every visit is that they know their body far better than we do. And if they feel like something is not right, that's something that warrants a call to us. And there's actually some studies done about women that had poor pregnancy outcomes, and many of those women felt for the 48 hours before they went to the hospital or presented for care that something was not right. So I usually encourage women, if that's what we're here for. That's what the hospital staff is there for, is to reassure them and to make sure that everything is okay.
Okay. And Holly, so we were talking, and we've touched a little bit about C-sections. So with, the statistics show that if you use or engage with a nurse midwife, that your C-section, it lowers the C-section rate. Explain that a little bit. What does that mean?
I think part of it has to do with being healthy and being proactive and staying active during the pregnancy, but also that sometimes in labor and delivery we don't take into account like a person's psyche and their emotional state, and sometimes we don't even look at that. And I think as midwives we are a little bit more patient to let the body kind of do its thing versus medically getting involved with things. And sometimes when we use medicines to alter the course of labor, we actually cause some stress in the baby, and then we need a C-section because the baby's not doing well.
You're right.
And but that relationship too, and I talk to patients all throughout my career, whether it be as a nurse and or as a midwife, and their perception of the care that they got sometimes it will help their labor along if they feel loved and if they feel supported in the room. I've had patients, in early labor, their water break and not in labor and just not going, just stop with their labor because they want a certain person there, or
oh wow,
they feel like they're connected with you. And to me, I'm always, if a patient asks me to be there, I always want to be there because it's not my birth. I just want to support them through theirs. And but I think that the support there is lots of studies out there about the benefits of using a doula during labor, and that's just a support person during labor that is your emotional support person, helps with some physical things, like encourages you to change positions, to take in enough fluids and things of that nature. But a doula decreases the risk of C-section as well, and that could be nothing but psychological. Decrease the risk.
Well, and Farrah, you can answer this. I mean, you're in a pretty vulnerable position when you're having a baby. I mean, that's those are the facts. So if you have that relationship, and I'm sure you see that with your patients, it's just so much easier. You don't feel as nervous. You got all these people around you, and you don't really know them because you've only seen them maybe 9 times. So, I think definitely that's something good for our patients.
Right.
Yeah.
And I think we provide education that minimizes their risk of having a C-section also. Like we go over labor precautions, like when you're in active labor, when to actually go to the hospital. Because some studies have shown that if you go to the hospital too early, you're more likely to have interventions that would lead to a C-section.
Yeah, and that's a lot of it, is what we do to patients when they're in the hospital that kind of creates that cascade of effects, snowball, that leads to having a C-section. And absolutely, there are C-sections that are needed. There are moms that need them, babies that need them, and we're very honored to work with the physicians that we do, but we want our women to be healthy and educated and make decisions that are best for them.
Yeah. What are some of the other myths that we want to kind of talk about here today that patients, we talked about, you don't have to have your baby at home. And you can, if, have medication if you absolutely need to, and you guys will support that. And what else are you seeing out there?
I think, myths about, because you see a midwife, you have to do things natural, you have to breastfeed, those things. We just want you to be educated and make a choice that is best for you and your family. Some people don't understand the education that a midwife has, because there are different types of midwives in the United States. Some that learn by apprenticeship, some that learn by vocational school, some that are bachelor's prepared in something other than nursing and then have a master's in midwifery. In North Carolina, certified nurse midwives are the only type of legally regulated midwives, and they are master's prepared nurses with a certification in midwifery.
So that kind of explains what we should look for. We definitely want to consider the different types of midwives, and I guess it's different state to state, but definitely make sure that that education is there and experience.
And some of the other types in other states, different types of midwives are regulated, just they're not in North Carolina. So their education is verified in certain other states, but in North Carolina, nurse midwives are the only ones that are recognized and regulated. So that's the important thing. And we're regulated, by the Board of Nursing, and we have an accrediting body, the American College of Nurse Midwives, just like physicians have the ACOG, and so they set standards for the way we practice.
Yeah, and I think it's important to mention that you guys are credentialed, just like all physicians and nurse practitioners. The hospital, you go through a credentialing process so that you can deliver at the hospital, and then of course in your practice having the certifications that you need and that training that you need as well. So I know we wanted to talk about maternal mortality as well. I know that this is an important topic and something that we're trying to work on. Not only in the United States, but throughout the world. And so let's talk a little bit about that. What does that mean, maternal mortality?
Go ahead.
Maternal mortality is the amount of women who are dying after childbirth or as directly related to childbirth.
Wow.
And unfortunately, with as much money as we spend on maternity care in the United States, our outcomes are not very good. We are one of the worst in the industrialized nations. And there are things that we can do differently to help with women and their outcomes. I know that all states other than California have had an increase in maternal mortality over the last several years by 26%.
Wow.
And with the amount of money we spend and the amount of interventions that we do and the medical stuff that we do, we should be able to not have this many women dying after childbirth.
Right. Farah, do you see, is there a particular reason that this is happening, why these percentages are so much higher?
I think part of it has to do with the obesity epidemic, honestly. Yeah, and the American lifestyle.
Yeah.
And women also, we have to consider here in the United States that we do a lot of artificial reproductive technology, and sometimes that is not done in a safe manner, where women who wouldn't get pregnant on their own are getting pregnant, and not only pregnant, sometimes with multiples, and those are very dangerous pregnancies, and they need to be monitored by the appropriate, high-risk people.
Yeah.
But those women wouldn't have conceived on their own, and not that we don't love for those women to have babies, but we need women to be healthy, because pregnancy is a healthy state when you're healthy at a baseline, but when you're not healthy at a baseline, then we have women that are dying from blood clots, hemorrhage, high blood pressure issues. And then, as Farah said about the obesity, we have women that are diabetic outside of pregnancy and didn't realize it, and then we're finding it as they become pregnant. And that is another whole, event of things that we have to combat with.
And and we could do a whole show on diabetes. I mean, I know that it's just terrible and running rampant in, our lifestyles, and, some people are born with it, but others, it's brought on by unhealthy eating and, obesity or just other comorbidities.
And I don't think it's the patients necessarily that are to be, it's our lifestyle here. It's the fact that it's much cheaper to buy, something that is already made than it is to buy a salad. And our society is so fast. And also that our moms are stressed. Our moms have to return to work so soon after delivery. And sometimes, within 4 or 6 weeks, because sometimes these high-risk moms have been off during their pregnancy, and then they're going to lose their medical coverage as well. So as a society, we're not doing things that is best for our moms and our babies. And if we're not taking care of our moms and our babies, our society isn't going to last very long.
Yeah. And it's weird that you mentioned, the fact that we do a lot of artificial insemination, the things that we do to try to have babies if our bodies aren't letting us do that. And you never thought about that there's the other side to that, the process that you're going through while you're carrying the baby and the risk and all that. And so I never thought about it that way. It really is something that we need to make people aware of.
Right.
Yeah.
And if we can, encourage women when we see them annually, have the discussion about weight, have the discussion about blood pressure, screen people that are overweight for diabetes before pregnancy, and maybe, work on a 10 or 15 pound weight loss, because we know we can have much better outcomes if we can get things, closer to a baseline.
Yeah. Yeah, and that goes back to make sure you going to your yearly exams. And really making sure that your health is in order. And I guess when you talk about family planning or, getting ready to have your baby, those are the things that you're discussing there and educating.
Absolutely.
Yeah.
We know that exercise too, one thing we don't talk a whole lot about, but exercising during pregnancy, people think pregnant, I shouldn't do those things, but actually it decreases your risk for hypertension, decreases your risk for diabetes. And we're not saying to go out and run a marathon. We're saying to do 30 minutes of walking. You can do it, 15 minutes broken up throughout the day, yoga, swimming, gentle things, but being active is very important.
Okay. And so what are some of the other things? Let's see, 82% reduction in mortality with universal midwifery coverage. What does that mean?
Just that that's that team-based care, looking at team-based care by midwives caring for normal, healthy pregnant women and doctors caring for the sicker women. By the most high risk people being taken care of specialists, and then middle risk being taken care of, OBGYNs, and then low risk women being cared for by midwives. The women that are low risk, that we can focus on, wellness and things and keeping them well, and then allowing the doctors to have more time with the sicker patients.
Yeah. And like I said, this is just a great service. I mean, I'm so excited to educate people that you are in our community, and there's choices for women. Because you're in a practice, I know. Let's mention all of our doctors are in the practice. Go ahead, Farrah.
Mention all of our doctors?
Yeah, sure.
There's Dr. Bailey, Dr. Marsbani, Dr. Prez, and Dr. Woodard.
Okay. And then Tammy, of course, is a nurse practitioner. Am I saying that correctly?
Yeah.
Yes. And then the two of you as well. So your practice is growing, but still small enough where you have that personalized care, and you're not just another number.
Yeah, absolutely.
Yeah. So I'm glad that there's choices out there for everybody. So, and I know that we've got some other resources where people can kind of do their own research, and we'll put these up on the screen for everybody to take a look at, but midwife.org, Lamaze.org, Childbirth Connections, and we'll put that list up there for everybody to take a look. But we also want to mention your practice again. So Triangle Premier Women's Health, which they are located in both Clayton and Smithfield. And Farrah and Holly can take care of all your needs there. And you can call to make an appointment with them, and I'm hoping I've got the number right here. Is it on the first page? Okay. So you can call to make an appointment, and that number in Clayton is 919-359-1077, or in Smithfield, it's 919-934-3015. And both of you work at both locations?
Yes.
Wonderful.
Yeah.
Great.
We both deliver babies at both locations, at both hospitals.
Okay, great. Well, thank you both for joining us today, and we look forward to having you back to talk more about topics with childbirth and women's care.
All right.
All right,
good.
thank you. Thank you for joining us for another edition of Johnston Health Talk, and we look forward to seeing you again.